Hello and welcome. Today we're talking about an interesting addition to the modern chiropractic practice. And we have Dr. Oka Botha with us, who has been teaching and practicing live blood analysis for over 20 years. So, hello, Dr. Oka.
Hi, Elizabeth.
So, let's start with the obvious question. Why should a chiropractor consider incorporating live blood analysis into their practice?
Well, there are several reasons, Elizabeth. The first is that chiropractic care has increasingly moved beyond simply addressing musculoskeletal complaints. Now, many chiropractors today take a much more holistic approach, looking at lifestyle, nutrition, stress, exercise, digestion, and other factors that can influence a person's overall well-being. Now, live blood analysis complements that approach by giving the practitioner another way of looking at the client. It also makes the consultation much more engaging. Now, we can talk to a client about inflammation, oxidative stress, metabolic health, or digestive function, but those concepts can be quite abstract. Now, when a client actually sees their own blood on a screen, these abstract concepts become much more real and tangible.
Yes, so you're saying that the visual component is particularly important then?
Absolutely, it is. And, one of the challenges that practitioners face in practice is getting their clients to understand things that they can't see or feel directly. So, for example, if we talk about oxidative stress, the average person may understand the words, but not necessarily appreciate what they mean in practical terms. They don't understand the impact of something like oxidative stress, what it has on their health, and how it might affect them in the long term. Now, with microscopy, we use the images as an educational and biofeedback tool. So instead of saying we need to work on your nutrition and lifestyle, the practitioner can explain what they're observing and why certain lifestyle choices may be relevant. Now, that makes the discussion much more personal and meaningful.
Okay, and I suppose that has a huge impact on compliance as well.
Well, yes, it certainly does. Compliance is often a major challenge in any health practice, even more so in complementary and integrative practices. Now, a practitioner may recommend better nutrition, more exercise, improved sleep, or stress management, but the client doesn't always follow through. When people are able to connect the recommendations to something they can actually see and understand, it immediately increases their commitment to follow the recommendations. The practitioner isn't simply giving them a list of things to do, you're involving the client in the process and helping them understand why those recommendations actually matter.
Okay, so let's talk about what a chiropractor might actually be looking at. What are the major imbalances or patterns of dysfunction that live blood analysis allows a practitioner to monitor?
Well, there are a number of functional imbalances that we are able to detect and monitor in real time with live blood analysis. Now, this is by no means a complete list of what we can see, but the most common patterns or anomalies can generally be grouped into five functional challenges. Now, the first is gut dysfunction and microbiome imbalance. We know that the digestive system is fundamental to health, and many clients present with digestive complaints, food sensitivities, or lifestyle factors that may affect gastrointestinal function. With live blood analysis, we can monitor a wide range of gastrointestinal imbalances, and actually watching those patterns improve as a result of changes that the client has made to their diet and lifestyle is extremely motivating and encouraging to the client. The second area is metabolic dysfunction, and this includes areas such as blood sugar regulation, lipid metabolism, and other factors associated with metabolic health. Now, when blood is viewed using dark field microscopy, we can see indicators such as chylomicrons and fibrin, which, along with specific dry blood anomalies, inform the practitioner about the client's metabolic health. Now, many of these patterns appear long before conventional testing would show any abnormality, which makes live blood analysis an important tool in prevention. The third is nutrient deficiencies and toxicity, the appearance of the actual blood cells as well as other patterns in live and dry blood provide information about a client's nutritional status versus the level of poisoning. Generally, patterns in live blood tells us about toxicity in general, whilst dry blood patterns tell us where those toxins have accumulated in the system. Now, we can track these patterns alongside detoxification protocols and actually watch as the toxins clear from where they have accumulated. Now, in terms of nutritional deficiencies, we can't tell the specific levels of nutrients in micrograms, for example, but we can see indicators for deficiencies in a range of vitamins and minerals. The fourth area is oxidative stress and chronic inflammation. Now, this is particularly interesting from an educational perspective because inflammation and oxidative stress are concepts that can be difficult for clients to understand. We can show them the effects that these processes actually have on their system and how certain diet and lifestyle factors are contributing to these processes. Seeing the patterns for themselves helps to get clients to actually grasp the importance of managing these issues in the long term, and also why certain recommendations are being made. And then finally, the fifth factor is hormonal and HPA axis dysfunction. Essentially, the relationship between stress physiology, the hypothalamic pituitary adrenal axis, and broader patterns of health. Now, again, just like with vitamins and minerals, we are not able to measure the actual levels of specific hormones, but we can clearly see indicators for endocrine dysfunction and which specific endocrine structures are actually involved. Now, it is important to mention also that although we get a wealth of information from live and dry blood analysis about a wide range of imbalances, we can't diagnose any diseases within these 5 areas using live blood analysis. Although we would detect red flags for specific conditions, even doctors who are able to make a diagnosis still need to then refer for conventional testing to make a diagnosis.
Okay, but that's if making a diagnosis is important in a particular case, yes?
Well, absolutely, yes. It's actually quite rare that making a medical diagnosis is important in a live blood analysis type setting. Most clients have already been to conventional doctors and have been given a diagnosis. What we are much more interested in are the underlying functional imbalances that have allowed for the disease or condition to develop in the first place. And those imbalances that are actually preventing the system from overcoming the condition naturally.
Okay, let's bring this back specifically to chiropractic practice. So, what other benefits does it offer a chiropractor?
Well, there are several benefits. First, it helps to create a more integrated consultation. Now, the chiropractor might already be discussing spinal health, posture, movement, exercise, and nutrition. Now, blood analysis provides another dimension to that conversation by looking at factors associated with the client's broader physiological environment. Now, second, it helps with tracking change over time. Now, one of the frustrations for both practitioners and clients is that improvements in health aren't always immediately obvious. Pain may improve, energy may increase, sleep may even get better, but sometimes clients need additional feedback to appreciate the progress that they're actually making. Repeated assessments performed appropriately and interpreted consistently, can provide visual feedback that supports the overall practitioner-client conversation.
Okay, so it becomes part of the journey rather than just a one-off test.
Exactly, and where it's particularly valuable then in a functional or integrative practice where prevention is so important. Now you can perform a more complete initial assessment, develop a more appropriate program around nutrition, lifestyle, and chiropractic care, and often of other necessary interventions as well, and then reassess at regular intervals.
Okay, so I imagine this feedback loop then improves retention.
Yes, yes, absolutely, because it gives the client another reason to stay engaged with the process. A client who comes in with back pain may initially be focused only on getting rid of the pain, but perhaps during the consultation, they discover that they also need to pay attention to sleep, nutrition, stress, exercise, or digestive health. Now, that can actually transform the relationship from a purely symptom focused interaction into a longer term health and wellness journey. For chiropractors who want to build a more comprehensive type of practice, that is very, very important.
Okay, and what about treatment outcomes? How does live and dry blood analysis actually help a chiropractor make better treatment decisions?
Well, it's a simple and effective way to determine the most important challenges in a case. Essentially, what you need to focus on in terms of natural interventions to address the key root cause imbalances that are contributing to the client's condition. Now, it provides the practitioner with another tool or another way to view and assess your client's health, where the actual imbalances that we have to work with and monitor in a natural and functional health setting to achieve lasting and meaningful results in a case. Now, we're able to track the parameters that are important when working with clients holistically more effectively than with other forms of testing.
And live blood analysis is said to be more sensitive than conventional testing with several metrics. Is that correct?
Yes, yes, that's absolutely correct. The conventional testing, have wide normal ranges and only really show abnormalities in pathology. When the challenges are at a severe enough level that a disease diagnosis can actually be made. So it's not really suited to test for optimal levels or to test when a specific area isn't functioning optimally. The aim there is to make a diagnosis. With live blood analysis, the aim is to achieve and maintain optimal health, even in cases where a disease diagnosis cannot be made.
Many people are unwell for years before diagnosis is finally made, aren't they?
Yeah, absolutely. That's correct. And, chronic disease rarely develops overnight, and there's usually a long period of subclinical imbalance where clients are not enjoying optimal health, but conventional testing can't really detect any abnormality. Now, these cases form a large part of a live blood analysis practice because we're able to identify the underlying issues in these cases.
Yes, so let's talk about the dry blood component. Why is that useful alongside live blood analysis?
Well, the two approaches work best together because many imbalances are revealed in a dry blood sample that cannot be observed in a live blood sample. A live blood sample allows the practitioner and client to see blood in a living state under the microscope, where the blood cells appear and behave exactly like they do in the body. Now, dry blood analysis involves viewing a series of dried blood droplets at low magnification and gives us information about oxidative stress, acidosis, inflammation, connective tissue, and lymphatic challenges, and much more. So used together, they provide a more comprehensive view of a client's biological terrain and health at the cellular level.
And what kind of chiropractor do you think would benefit most from incorporating live blood analysis?
Well, we have some chiropractors who have completed the training course already. Live blood analysis is particularly suited to chiropractors who already have a functional, integrative, or holistic type of approach. If your practice is primarily focused on acute musculoskeletal pain or care, you may have less need for it. But if you're already talking to clients about nutrition, lifestyle, stress, exercise, digestion, and general wellness, then it will fit naturally into your practice. Now, it also helps to differentiate the practice. Instead of simply saying we take a holistic approach, you can demonstrate what that approach actually looks like in practice.
And from a business perspective?
Well, it creates additional opportunities in practice. A blood analysis consultation can become a standalone service or part of a broader assessment program. Now, more importantly, it helps to shift the conversation from purely reactive care to ongoing health optimization. Now, when clients become more engaged with their health, they are far more likely to stay committed to longer term programs involving nutrition, lifestyle changes, exercise, and regular chiropractic care. Now, it also brings new clients into the practice because clients are curious to see what the rest of the family's blood also reveals. So there is a clear business benefit, but we always put the clinical value first.
The chiropractor was considering adding live and dry blood analysis to the practice. What would you say they should focus on first?
Well, training is probably the most important consideration. You need to understand microscopy, the sampling techniques, interpretation of anomalies, the limitations, and also how to clearly communicate your findings to your client. Now, a well-structured professional course is essential in helping you integrate live blood analysis into your practice. And the other critical consideration is the type of microscope. Not all microscopes advertised as dark field or live blood analysis microscopes are actually suitable for professional practice. There are many faint structures in dark field that are very important to monitor, but are only visible with a professional dark field microscope.
And that's a very important point. We've had many attendees over the years who unfortunately didn't do the research and bought a microscope online, only to find that it doesn't allow them to see most of the dark field anomalies. It's been a bit of a problem, hasn't it?
Absolutely, it has. And, then those microscopes cannot be upgraded, which means that those practitioners are stuck with a piece of equipment that they cannot use. And that's why we always talk about the importance of looking at the actual specifications carefully before buying a microscope.
So if you had to summarize the main reasons a chiropractor might incorporate live and dry blood analysis into a functional practice, what would they be?
Well, I'd summarize it in 5 points. So, firstly, it makes visible concepts more visible and understandable. Secondly, it increases client engagement because people are seeing information relating to them directly. Point number three, it supports compliance by helping clients understand the reasoning behind lifestyle and nutritional recommendations. Point number four, it provides a valuable source of information about a range of clinically relevant functional imbalances that can be monitored alongside interventions. And finally, the fifth point, it helps create a more comprehensive integrative model of care where musculoskeletal health is considered alongside nutrition, metabolic health, stress, digestion, and lifestyle.
And ultimately, it's about giving the client a better understanding of their own health, isn't it?
Exactly, exactly. And one of the most important and powerful things that a practitioner can do to help a client become is actually to help a client become an active participant in their own health. When someone understands what you're trying to achieve, understands why you're making particular recommendations, and can see those changes taking place over time, they actually become engaged in the process. And that's where live and dry blood analysis is particularly useful for the right type of chiropractic practice.
So, if viewers are interested in finding out more about adding this to their practice, or if they'd even like to enroll on the training course, how or where would you suggest they begin?
Well, the best would just be to visit our website, livebloodonline.com, and just use the information on there to read more about the training course and also to enroll for the next course.
Okay, well, thank you very much for that. And we look forward to hearing from you. Info@livebloodonline.com is where you'll find all the information. Thank you for joining us. And thank you, Dr. Ocker.
Thanks very much. Bye bye.
Thank you. Bye bye.